I'm Dr. Darcie Weglo from Creekside Dynamic Health, saying hello to everybody who's at home. Seeing as how we're closed for COVID-19, we are still wanting to make sure everybody's staying healthy and mobile and helping you move in your bodies in case there's anything there that's giving you a problem. We wanted to send out some videos for some self-care. So today we'll be focusing on back health and some movement patterns that you can do to keep yourself agile and free from pain. So we're gonna start at the top of our mat. We're gonna stand at the top and be nice and tall there. And to get down to the mat, I like to do a reverse lunge. So we just lunge back with one foot, drop the knee, and we swing our other knee around. Just an easy way to get back down to the mat without bending over and hurting ourselves. Then I'm just gonna sit back on my heels. I'm gonna be really tall in my spine. I'm just gonna put my hands across my chest. I'm gonna do something called hip hack. So I'm just gonna kind of come up with my hips, keeping my spine really tall, imagining there's a pane of glass here that I'm not folding into, so I want to stay really tall, and it just gets me driving through my hips a little bit, moving my pelvis forward, gets me out of overloading my back a little bit. Then I'm going to sit down, and I like to do a stretch here, so I usually just walk my hands out, widen my knees, get into that familiar child's pose pattern, take some deep breaths there. I tend to do 5 deep breaths. Try to get my fingertips further every time. And once I've done those breaths, I usually walk out to quadruped position, so on all fours. Now for this, I'm going to get into something called bird dog. So this is where I'm going to put my hands right under my shoulders, my knees right under my hips. I'm going to focus on neutral spine, so not being arched up or arched down, but finding that nice middle ground. And I'm going to try and keep my back as still as possible while I just reach out, opposite arm, opposite leg. Reaching through fingertips, through heel. Hold for 2 count, and then slowly come back in. Keeping that pelvis and back as still as possible. Reach, really reach there. Keeping my neck up and long. I like to do that for 5 to 7 each side. And then I usually follow it in between my reps with something called cat-cow. So I'm just arching up, really tucking my butt, tucking my head in. And then I'm gonna go the other way, sticking my butt out, opening my chest forward, all the while keeping my arms as straight as possible. Great mobilizer for the spine. Good, and then you can throw in another child's pose there if it feels good. Then I come forward after 5 deep breaths, and I'm going to go into a front plank. So I'm going to lay down on the ground, get my feet about mat width apart, interlace my fingers, elbows right under shoulders, keep my neck long and tucked in, and lift away from the ground. Now to make your plank hard, try to pull your arms down to your feet a little bit and hold that. So we don't want to see you bottoming out here. You want to keep those hips lifted up. And so you want to try and hold that for about 30 seconds. And once you've done that, you can just drop back down. And then I always like to throw in an extension here, pushing up as high as you feel comfortable, letting your tummy just relax, using your arms to push up. Opening chest, long neck, and then come back down. And that's it for our spine flow today, and then you get back up the same way. Come on up to a lunge, push up, and you're done. That's our flow for back health today, and I hope that you can do that on a daily basis to keep things moving and feeling good. Just for preventative as well, for if anything is bothering you. All of those will be feeling good for relief as well. So thanks for tuning in, and we'll keep you updated with changes as well as more things to come. Take care, guys.